Now, scientists have long debated whether stress causes cancer. Now, a group of Australian researchers has found that it can have an adverse effect.
A team at Monash University has found that stress can turn parts of our body into a so-called superhighway for breast cancer cells. Dr. Carolyn Lay from Monash University joins us now. Dr. Lay, good morning. Good to see you.
Thank you. Thanks for having me.
So does stress cause cancer, or does stress cause cancer to develop and spread?
Yeah, it's a really good question. It's a question that we get asked quite a lot. The majority of the evidence out there shows that stress doesn't cause cancer. But if you already have cancer and you have prolonged periods of stress, it promotes the spread of cancer.
It's a bit of a cycle, isn't it? Because having cancer, certainly having a diagnosis of cancer, does induce a lot of stress, doesn't it?
Right, exactly. And it's not just the diagnosis, it's throughout the whole treatment. So we've spoken to a lot of clinicians who talk about how stressed patients are going into surgery, for instance, and going through chemo. So the whole process, like you said, it's a catch-22, that the whole process is stress-inducing, yet we're finding that stress can actually cause it to become much worse.
So before we get to that, let's define stress for those who might be thinking, well, you know, what actually is stress then? Because we all live a pretty stressed environment. Is it anxiety? Is it worry? Is it panic? Or is it something else?
Yeah, so particularly what we look at and what we've shown really impacts cancer, it's that lack of coping mechanism that we find. So a little bit of stress is good. It actually boosts your immune system and it helps you fight infections and certain diseases. However, this prolonged period of stress where you feel like you can't cope activates a certain pathway that we find then promotes cancer.
So if you're breaking down in tears often, for example, that's an example of you being in that extremely stressed state.
Exactly. And so for the human data out there, people have looked at poor coping mechanisms, low socioeconomic status as well. So that lifestyle really impacts.
You've had tremendous success so far on your team's research efforts, Caroline. Clinical trials are underway at the moment. How are they going?
Yeah, they're going great. So we've got a clinical trial running at the Peter MacCallum Cancer Centre in Melbourne. We started recruiting the start of this year, and we've got a good influx of patients. So it's exciting times.
So you found that the stress can sort of create this superhighway, this pathway for the cancerous cells to migrate and move through, and therefore exacerbate the situation. How are you thinking then in terms of trying to put a roadblock on that highway?
Right, exactly. And so the biggest issue with this kind of work is we don't want to blame the patient and we don't want to put the burden on the patient, saying that stress makes cancer worse. How is a patient supposed to deal with that?
Yes, off you go and do, TM 24 hours a day.
You've been diagnosed with cancer, but please don't stress, it makes your cancer worse. And so what we have really spent a lot of time doing is understanding the mechanisms, the pathway that's activated, and then we found a drug now that's actually a blood pressure medication that just happens to be able to block that pathway that stress activates.
So is it a beta blocker or?
Yeah, exactly, it's a beta blocker.
Oh,
so that's the trial. That's
just
the trial.
Something as simple as that.
Yeah, exactly. It just happens to be that this drug blocks the same pathway that stress activates.
I was sort of thinking maybe you just give us a big handful of Valium or something.
Right, but a beta blocker sounds like the way.
Well, that's great. So what's the rough timeline? I mean, it's very hard in research efforts anywhere to put timelines, but are you looking at a certain goal, a certain target, a certain date?
Right, so the clinical trial that we have running at the moment is more of a window of opportunity trial. So we're looking at patients right before they're going into surgery, giving them these beta blockers and then assessing their stress and also certain markers for cancer outcome after the surgery. So it's a very short window, and based on that, we'll then slowly extend the trial out to look at longer term outcomes.
Now, we need to ask you also about life working in that extraordinary new centre, which is the Comprehensive Cancer Centre, where Peter MacCallum is in Melbourne in Victoria now. It looks like, from what I've seen, an incredible place now for cancer research. What's it like in there?
It's amazing. So you can, any wonder Joe Biden came down and flew all the way to visit. Yeah, it's amazing. Fitting into the theme of stress, it doesn't look like a hospital. It's amazing. It looks like an art gallery. There's this big atrium in the middle, and you've got access to researchers, clinicians, oncologists, all on your doorstep. So it's an incredible institution.